The introduction of chemotherapy has improved the survival rate of patients with bone sarcomas. Furthermore, development of chemotherapy has also enabled good local control, with limb-sparing surgery being used in 90% of patients. Limb-sparing surgery comprises end prosthesis, allograft, autograft, destruction osteogenesis, or artificial bone graft to reconstruct bone defects following tumor resection. Surgical site infection requires irrigation surgery, use of antibiotics for a long period, delays in the treatment course, which increases mortality. In general surgery, biomaterial has been considered to be a risk factor for surgical site infection. Locations and incidence of surgical site infection in a hospital. Pelvic reconstruction showed the highest infection rate, 42%. Also, tibial reconstruction showed 25% infection rate. The other locations showed lower infection rate. In total of 302 cases, infection occurred in 33 cases, 11%. What about risk factors? Use of implant, chemotherapy, long operative time, diabetes, and pelvic tumor are risk factors for surgical site infection. Incidence of SSI in proximal femur in the literature is 4 to 11%. 11%, the highest one, was showing composite use of frozen autograft and prosthesis, but the patient number was small. In the series of end prosthetic replacement, infection rate was 4 to 6%. What about pelvic lesions in the literature? Infection rate varied from 15 to 36%. When no reconstruction was conducted, the infection rate was the lowest, 15%. To obtain better limb function, reconstruction using implants and biological methods are needed. However, the reconstruction with long operative time may increase the risk for SSI. On the contrary, a simple procedure like amputation leads to low risk. Basically, we perform biological reconstruction using tumor-bearing frozen autograft because the incidence of surgical site infection in proximal femur is low. The figure shows a reconstruction with composite of frozen autograft and prosthesis, pedicle freezing procedure. Treatment strategy for bone tumors in pelvis. Preoperative assessment and discussion about the functional benefits and risk for surgical site infection before surgery. Very important. Reconstruction with tumor-bearing frozen autograft using plates or prosthesis if possible. What should we do to prevent surgical site infection? Shortening of operative time. Operative time is one of the strong risk factors for surgical site infection. Antibacterial implant, iodine coating or silver coating if available. Also, simple procedure. Amputation, hemipelvectomy, no reconstruction, and they provide low risk of infection. From now, some representative cases of shortening of operative time. 12-year-old girl, Ewing sarcoma, preoperative MRI chemotherapy was very effective. Preoperative plan involving the use of a computer navigation system. We checked the margin using computer navigation system. After osteotomy, and freezing in liquid nitrogen of resected specimen. Post-operative radiograph 2 years after operation. No osteoarthrotic change. It works. She can walk almost normally, and there are no limitations in the sitting posture. Next is 48-year-old female, chondrosarcoma, grade 2, preoperative planning using 3D printer. Tumor excision and freezing in liquid nitrogen. 3D printer enables plate bending and plate fixation concurrently. Intraoperative view and radiograph just after operation. When we get used to navigation system on the 3D printer, we can shorten the operation time. Next is antibacterial coating on implant. In general surgery, biomaterial has been considered to be a risk factor for surgical site infection. In bone tumor surgery, use of implant is one of the risk factors for surgical site infection. We developed iodine coating on titanium surface. Iodine supported technique is as follows. Titanium surface was treated with oxide film by anodization. Anodic oxide film was 5 to 10 micrometer thick with more than 50,000 micropores per square millimeter, and the capacity of iodine support 10 to 12 microgram per square centimeter. Advantages for iodine-coated technique: good antibiofilm effect, long antibacterial effect, good osteoconductivity, safety to human cells. We published several papers looking plate before left side before iodine coating, right side after iodine coating. We can apply iodine coating technology to various titanium implants, tumor prosthesis, hip and knee, spinal instrumentation, and trauma implants. This is data of iodine-coated implant. It can decrease the risk of surgical site infection. In our series we published in 2019, odds ratio of the use of iodine-coated implants was 0.29, significantly lower. In conclusion, due to high risk for surgical site infection, surgical treatment in pelvis and hip is challenging. Use of 3D printing, navigation system, and antimicrobial implants such as iodine-coated implants are recommended to reduce the risk of surgical site infection in future.